of my CRMA medication administration. So 8 rights of the administration. The right person, make sure you have the right person that matches the person on the MAR. The right medication to ensure that you administer the medication right. There are specific procedures to follow. The 3 checks are: 1. When removing the bottle or bingo card from the cabinet, compare the label on the information with the information on the MAR, the medical administration record. Before popping the medication, compare the label with the MAR. And then the 3rd check is before returning the medications to the medication cabinet. Again, check with the label on the MAR. The right dose. When comparing the label to the MAR, check the dosage ordered. Only give correct amount. If the dose on the label does not match the MAR, you do not give that medication. The right route. The medication is only administered by the correct route. The right time. Each medication must be given at the right time. Some flexibility can be allowed, but no more than 60 minutes early or 60 minutes late. The right to know. Each person receives medication has the right to know the name of the medication they are taking. The right to refuse. Each person has the right to refuse to take the medication prescribed to them. The right to accurate documentation. A medication administration is not complete until the CRMA documents on the medication administration record. In addition to the 8 rights, do give your full attention to the task at hand. Do remain with the person until the medication has been swallowed. Do prepare medications for only one person at a time. Do not give a medication from another person's container. Do not hide a medication error. Assure that there is no one talking or distractions when giving medications. Pass only what you have prepared, and do only what you are skilled to do. Medication orders. It is not within the scope of practice for the CRMA to make recommendations to the duly authorized licensed practitioner for suggesting medications or changes of times of medication. It is within the scope of practice for the CRMA to report signs and symptoms that may require changes in the medication regimen. No person may administer medications without a valid written order on file within the home or the facility. Orders may be written on a variety of forms, as long as the order contains all of the required elements. So, the required elements are the resident's name, the name of the medication, the dosage, the time to be administered, the date order was written, the route, any special instructions, and then it also has to have the practitioner signature, and electronic signatures are acceptable and binding. So, prescriptions. A prescription is usually a 3x5 size piece of paper that is only one leaf of a pad. Prescription forms must have all of the previous elements along with authorized provider's name, address, phone number, and a DEA number, which is a unique number denoted their ability to write prescriptions for controlled substances. Medication labels. Medication labels must contain certain information on the label if the medication is going to be used in the facility where you work. A label must be affixated to each medication, whether it is a bottle, a bingo card, or inhaler. Each label must contain the pharmacy name, the prescription number, a person's name it is prescribed to, date prescribed, directions of use, physician's name, medication name, strength, and amount of medication given, number of times it can be refilled without new prescription, expiration date, storage instructions, and any special information such as take with food. Telephone orders. Telephone orders may only be accepted by a registered nurse, a licensed nurse, and a pharmacist. Faxed orders are acceptable legal orders as long as they are in compliance with the Commission on Pharmacy Rules and Regulation. Written dated orders for telephone orders and fax orders must be signed by a licensed practitioner within 5 working days. Stop orders. An entry must be made on the medication administration record to indicate whenever a medication or treatment is started, given, refused, or discontinued. A medication cannot be discontinued except with a signed and dated order from a physician to do so. Oh, so this is routes of admission. When giving medications by mouth, such as pills or liquids, there are some basic things to remember. Make sure that the individual is in an upright and sitting position. Never give pills or liquid to an individual lying down. Many individuals can only swallow one pill at a time. Be careful to give only the number of pills that the individual can swallow safely and easily. Medications may be administered utilizing a variety of methods: oral, rectal, vaginal, topical, eye drops, ear drops, nose drops, and inhalants. Crossing medications. Some residents are unable to swallow solid oral medications. For these residents, medications may be crushed, but not all medications can be crushed. Crushing medications may produce unwanted pharmacological effects in the residents and may be tantamount to administering doses of the medication other than the prescribed. Crushing any medication should be avoided unless a liquid dosage of form or substitute in liquid form is not available. Documenting on the medication administration record. All information written on the medication administration record must be done in ink. The MAR is a legal document and may be used in court. It is imperative that you use the same rules surrounding your documentation on the MAR as you do for any other documentation in your facility. Black ink is preferred over any other color because it can be photocopied well if needed. Some homes/facilities use a color coding system on the MAR. You must follow the rules and procedures established where you work. The following are a few tips to remember when completing and documentation. So 1, write legibly. 2, spell correctly. 3, sign everything with your full name and credentials. On the MAR, there will be a place for you to sign your full name and credentials so that your initials can be identified. Use medical terms and abbreviations only if you know their meaning. When you make an error, draw one line through the error, write error, and initial the mistake. Never use whiteout, erase, or scribble out a mistake. This will compromise the document's authenticity as a legal document. Be specific and objective in documenting. Never add previous entries or backup date information. You pop them, you give them, you document them. And when using highlighters, yellow highlighters is the only color that can be photocopied. So this is what a MAR looks like. So you've got the date, up to the month, the time they take the medication, name, allergies, month, year should all be on the MAR. The reason why they're taking the meds, so like this one says for ADD. And then in the boxes, when you give it to them, you put their initials. So medication error report. In spite of all we do to prevent errors, occasionally a medication error will occur. When a medication error occurs, it is extremely important that you follow your agency's protocol for this situation. Most agencies will require to make out a medication error report. There is a sample in the next slide. Basically, they all require the same information though. Name of the client, medications, and what happened and who was notified. The medication error report will become part of the client's record. Therefore, all the rules of documentation apply. They are always done in ink and never erased, etc. So common types of medication errors is wrong person, wrong time, wrong dose, wrong route, wrong medication, wrong documentation, refusal, and transcriptions. So this is just a example of what a medication error report could look like. So you'd have the client's name, the date of the incident, medications involved, description, type of error. Documentation and record keeping. The MAR, setting up a new MAR, adding medications. Be on the lookout for rules, laws, terms. How to set up a new MAR, adding medication to the MAR. How to update the MAR. The steps for discontinuing medication in situations where a discontinue order is not needed.
I saved the MAR form for last. The best way to learn is to break it up in steps and systematically fill the form out. I want you to write down all of the steps on your worksheet. We will start with a discussion and I will show you examples. Then we'll be completing the example together. I would like you to print out the MAR so you can write it in. Later we will be doing some interactive video that will allow you to type in the responses similar to doing the MAR exam. If you will complete the exercise, you should understand what to do to pass your MAR final exam. Please be sure to contact me at pat@mededamerica.org if you're having problems and not getting the knowledge checks 100% correct. I will help and explain further. Remember, you must get 100% on the test to pass. Please just follow the steps and you will do fine. First, I will teach you how to set up a new MAR and perform all the tasks necessary to keep your client's MAR accurate and up to date. We will be doing a number of exercises that will set the foundation, then build on it until we have a completed routine MAR and a PRN MAR with examples of tasks you must be able to perform. Please review the things I have listed for you to be on the lookout for. They will help you focus on the objectives for this section. In this lesson, we will be setting up a new MAR and looking at the components of completing MAR entries. Please be sure you have printed 2 copies of both the front and back of the MAR so you can fill in the information as we go over it. Note, copies are included as part of your worksheet. If you print your worksheets, you will not need additional copies. When setting up a new MAR or completing a MAR entry, it should be done systematically. The system I will teach you helps to make sure everything is entered correctly and all the necessary information is included. Each task is divided up in steps and different parts of each step. Please either write them in your notes or on your worksheet. Do whatever you need to do to remember the steps and the parts for each task, be it setting up a new MAR, adding an entry, changing an order, or discontinuing a medication. By doing this, it will not only help your documentation accuracy, but it will make passing the MAR exam a matter of determining what you're being asked to do, then plugging in the correct steps and parts. In this lesson, we will be using the information for Jesse James. You may find the information for the corresponding exercises on your worksheet, or you should copy it from the slide at the beginning of each task. The month and year are July 2019. Your name is Pamela Carter. Jesse James is a 27-year-old female with cerebral palsy. Her medical history includes high blood pressure and anxiety. She is allergic to sulfa drugs and bee stings. She has no food or other allergies. You have prescriptions for the following medications. Lisinopril 20 milligrams PO daily in the morning. Prescription is written by Dr. Jones on May 1, 2019. The medication label says, Lisinopril 20 milligrams, take 1 tab by mouth once daily in the morning. Ativan 0.5 milligrams PO BID. Prescription is written by Dr. Jones on April 1, 2019. The label says, Ativan 0.5 milligrams, take 1 tab by mouth twice daily. Notice the label tells you to take 1 tablet, but the prescription doesn't tell you how many pills. The pharmacist will determine how many pills you will give when he dispenses the medication so the total doses will equal the amount ordered. If the strength on the order is different than the strength on the medication label, call the pharmacist and verify the medication that was dispensed is correct. On the test, if it doesn't tell you how many pills to give, it will be 1. Most of the time, the pharmacy will have a supply where 1 pill will be the strength for the amount ordered. The standard medication times. Morning MedPass 7 a.m. Afternoon MedPass 2 p.m. Evening MedPass 7 p.m. BID 7 a.m. and 7 p.m. TID 7 a.m., 2 p.m., and 9 p.m. Bedtime 9 p.m. Step 1. First, we will focus our attention on the header of the MAR. If you're starting with a blank MAR, as we are in this example, you will enter the name of the client, the month, and the year. If the MAR has information on it, double check to be sure it is correct and matches the information for the client whose MAR you are updating. Step 1 has 3 parts. 1. Entering the client's name. 2. Entering the month. 3. Entering the last 2 digits of the year. Please enter them on the MAR on your worksheet. Then click to go to the next page. compare what you wrote to the slide, and correct any errors. Step 2. We will enter, or if they have already listed, confirm the client's allergies. Be sure to include medication allergies, food allergies, and other allergies such as latex, bee stings, ant bites, etc. It is essential the food allergies are listed. Often a food allergy can indicate the potential for a medication allergy. For instance, if someone is allergic to eggs, particularly duck eggs, there's a good chance they may have an allergic reaction to a flu vaccine. No known drug allergies equals NKDA. No known allergies equals NKA. You can also write no allergies or none. If the client may have no drug allergies, but they do have another type of allergy, such as a food, bee stings, a latex, ant bites, etc., write NKDA, then the allergy or allergies they do have. Example, NKDA, allergic to latex and peanuts. Enter the information for Jessie's allergies on your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. Be sure to write the allergy or allergies on the MAR. Or if there's no known allergies, write NKA, none, or no allergies. Never leave this line blank or write N/A. Remember, N/A means not applicable. If there are no known drug allergies but another type of allergy, write NKDA, then list the other allergy or allergies. Step 3. Enter the information for the medication next. Be sure to write the name of the drug, the strength of the medication, such as how many milligrams or milligrams per mil, how many or how much is to be given, and how often it is to be administered. You will also need to include special instructions if applicable. The best way to complete this step is to copy the information directly from the medication label if it is a prescription medication, or from the doctor's order or prescription if the medicine is an over-the-counter drug or supplement. Enter the information for Jessie's medications on your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. Step 3 will have either 3 or 4 parts. Often it will only be the first 3, but be sure to include the 4th part if it is listed on the label. 1. The name and the strength of the medication. 2. How many to take and what route. 3. How often to take the medication. And 4. Specialist instructions if applicable. Step 4. Write the prescriber's name. This could be the doctor, APRN, or PA who wrote the prescription. Also put the date that is on the prescription next to the prescriber's name. Enter the prescriber's name and the prescription date on your worksheet. Then click to go to the next page. Compare what you wrote to what is on the slide and correct any errors. Step 4 only has 1 part, but be sure you enter both the prescriber's name and the date the prescription was written. The prescription date will explain why some of the blocks at the beginning, when the prescription first starts, are lined out. It will also help you keep track of when the prescriptions or doctor's orders, which are kept in the MAR book, are close to expiring and need to be renewed. Step 5. Enter the time routine medications are to be given. Most group homes and providers have set times for medication passes. When assigning the times, read the label carefully to be sure there is not a specific time or number of hours between doses. There is a considerable difference between 4 times a day given at 7 a.m., 11 a.m., 3 p.m., and 7 p.m., and every 6 hours, which is 7 a.m., 1 p.m., 7 p.m., and 1 a.m. Enter the times the medication should be given on your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. There is only 1 part for this step. However, you will be adding 1 or more times for the medication. The times are based on how many times you will be giving the medications in a day. Use the directions on the label and the standard MedPass time set up by the provider or facility. Always double check for specific times or the number of hours between doses that may be included on the prescription or doctor's order. After you have entered all of the medications on the MAR, go to the bottom of the page, sign, then initial. Always double check that you have initialed and signed all of the MAR pages that you will be using for your documentation. Failure to do this could cause you to fail the MAR examination, or if it was a client's record, cause the provider to receive a citation of noncompliance if a monitor notices that you have documented the MAR but failed to sign and initial the form. Sign and initial at the bottom of the page of your worksheet, then click to go to the next page. Compare what you wrote to the slide and correct any errors. Step 6 is the last step for the front of the MAR. It has two parts, even though intuitively you may think it was only one since they go together. 1. Sign the MAR. 2. Put your initials in the box next to your signature. For the MAR final exam, when you answer and enter the name and initials, be sure you use the name that you are assigned in the question, since the program will be looking for a specific answer. To complete setting up a new MAR, we will move to the back page of the MAR. You may have several back pages attached to the front side of the MAR, dependent on how much information needs to be recorded on the back of the MAR. Be sure the client's name is on each of the pages. I have a separate section to teach you how to properly document the required information. For this demonstration, we are just looking at preparing the MAR for use. We're at the last step, and it has three parts. 1. Be sure you write the client's name at the top of the page for each blank page attached to the MAR. 2. Place your signature. 3. Write your initials. Enter the client's name, then sign and initial the bottom of the page of your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. You should now have a completed MAR page with corrections, if any. Use the steps, complete it systematically, and you should have no problem setting up a new MAR. We are going to build on this foundation in the next section. Keep this MAR, you will be adding to it. Please get a highlighter also. You will need it for the next lesson. In this section, we will be completing a medication error report based on the information supplied for the off-site custody of medication form from the last lesson. I will go over the form and the rules as we work through the report. I would like you to be on the lookout for situations when a medication error report is indicated, how to complete the report, the deadlines for submitting the report, where to submit the report, and the follow-up report, what needs to be sent and when. There are several situations when a med error report needs to be completed. The type of medication errors are listed in the area that's highlighted in yellow. Most errors may be avoided by utilizing the 5 rights plus 2 that we have previously discussed. Remember, medication errors must be reported to the facility supervisor, and the medication error report form must be submitted to the regional office within 24 hours of the discovery of the error. We will be completing the form systematically using the information from the off-site custody form. The first part, highlighted in yellow, looks at who is involved and gathers some basic information. Use the following information to complete your form. 1. Client Jesse James. 2. Date of birth 7/9/1995. 3. Date 7/17/19. Time 10 p.m. 4. Provider Best Provider Incorporated is a group home. 5. 123 Rainbow Drive, Pensacola, Florida 32505. 6. I'm a map, title map. 7. I'm a map, title map, validated yes. 8. Just a super, title supervisor, validated no. Fill in the information above on the medication error report in your worksheet. The numbers correspond to the numbers on the slide. When you are finished, go to the next slide and check your answers. Correct any errors. How did you do? Make any corrections or additions. Now, let's look at the next section. Here we list the date of the error. This is when the error occurred. The report date is within 24 hours of the discovery of the error. 1. The error occurred on July 15th. Cindy stated she forgot to give Jessie her second dose of Ativan on July 15th. 2. Name of the medication, Ativan. Dose 0.5 milligrams. Time given 7 p.m. Doses involved 1. 3. Yes, it is a controlled substance. 4. Type of error and reason if applicable. Medication not given, failed to give. Fill in the information above on the medication error report in your worksheet. The numbers correspond to the numbers on the slide. When you are finished, go to the next slide and check your answers. Correct errors, if any. Take a few moments to double check your answers and make any necessary corrections. When you finish, please click to go to the next slide. In this section, you will record what happened. Document objectively only the facts: who, what, when, why, and how. If the error resulted in a doctor or ER visit or hospitalization, check the box. Then describe in the area if medical care is required. 1. When writing your description, be sure to include 1. That you discovered the amount received was different than the amount you expected to be returned. 2. Cindy stated she forgot to give the 7 p.m. dose on the 15th of July. 3. That you notified your supervisor and she will notify the doctor and the waiver support coordinator. 4. There was no medical care given because Jessie appears to have no adverse reaction to the missing dose. When you finish your narrative, complete the section for notifications. Part 2. 1. Doctor is Dr. Jones. 2. Support coordinator is want to support. When you have completed your worksheet, click to go to the next slide and compare your responses to mine. There will probably be different, but should be very similar if you documented objectively and included all of the 4 facts listed above. How did you do? The rest of the form is filled out by the supervisory personnel, the APD provider, and the staff at APD. Generally, the medical case manager will review and make recommendations. I am going to just take a few minutes to discuss these areas, but we won't be completing them. When you have finished reviewing the example documentation, click to move on to the next slide. This section is completed by your supervisor. The supervisor will analyze the situation and determine the cause. Corrective action or plans are developed to prevent this occurrence from happening in the future. The corrective action that is taken or plans are described in this section also. In our example, it was an error by the family. Dependent on whether this type of situation is isolated or an ongoing problem would determine what corrective action is needed. If you made the error and receive a task or tasks to complete as part of a corrective action, it is important that you complete the plan of remediation and have it submitted by the deadline. Failure to complete the corrective action may result in you losing your MAP status. The last page of the medication error form is completed by APD. Usually, it is the MCM that will complete the form and make recommendations for corrective action if applicable. Copies of completed forms are forwarded to an APD office for analysis and reporting at both the state and federal level. APD recommended follow-up and provider recommended follow-up must be completed and submitted by the deadline. If you or your supervisor have any questions concerning the deadline or what is required for the follow-up, be sure to contact the MCM that is working with you and clarify. Again, I can't stress enough how important it is that you complete any corrective actions or plans of remediation and submit the documentation of completion by the assigned deadline. The law requires that special precautions be taken for medications that are considered controlled medication. We briefly talked about what a controlled medication is in Module 1, and I will discuss it further in Module 5. Remember that controlled medications must be locked in a container that is locked within an enclosure. In other words, they're double locked. In addition, a count verifying the amount remaining is correct based on the previous count less the number given. Counts must be performed at shift changes or at least every 24 hours. I would like you to be on the lookout for techniques to properly set up a new controlled medication count sheet, accurately record a count, accurately record the administration of a controlled medication, and the techniques used for performing a count during situations when two MAPs are not present for the count. Controlled medications may be dispensed in several types of containers. For instance, a bottle with a medicine label, bubble sheets, etc. Each supply of medication must be counted and have its own count sheet. Remember, in this situation, the word supply could mean that all of the doses come from one container or card, or the supply is for a specific time of the day. For this reason, you record the scheduled time on the count sheet. Pay close attention to the packaging, labeling, and the times on your count sheet when performing your controlled medication count. If the medication is in a bottle, it's pretty easy. One bottle equals one supply equals one count sheet, unless it takes more than one bottle to supply the medication for the entire month. If it comes in a bubble pack, you give more than one dose a day, you must be sure the pharmacy did not dispense one card for each dosing time. Generally, they will put an alert sticker that says morning, noon, evening, if it's a different card for a different administration time. If it's one supply and more than one card, you usually will see a sticker at the top of the card that says 1 of 2 and 2 of 2. The bottom line, pay attention and be sure that you have set up your count sheet to accurately reflect your supply. In this exercise, we will complete the setup for the count sheet that makes several entries, both recording the administration or supervision of the medication and completing several types of shift counts. Jessie James has received her refill for her medication. Ativan 1 milligram POBID. There are 60 pills and the prescription number is 795119. Standard med pass time for BID is 7 a.m. and 7 p.m. Let's fill out the header on your count sheet form included on your worksheet. 1. Name of the medication. 2. The dosage. 3. The route. 4. The individual's name. 5. The start date, which equals the date the medication was received. 6. Verify and write the number of pills, capsules, or volume you received. 7. Enter the prescription number. 8. Enter the time the medication is to be administered or indicate if it's a PRN medication. 9. The people receiving this medication and confirming the count initial that they have received the medication. 2 people is preferred, but 1 is acceptable. You will always record the number remaining in the column I highlighted in yellow. This is how many are there right now if I went and counted them. You only write in the green area if you're giving a medication. You only write in the orange area if you're doing a shift count or a daily count. There may be blank lines in the green area or the orange area, but never in the yellow area. You may print the count sheets on the front and back of the page. Use as many pages as needed to record the counts until all of the medication is gone or expired. In this example, you will notice the medication is PRN. Diastat is generally only ordered for breakthrough seizures. The person could foreseeably not need the medication for weeks, months, or even years if his seizure disorder is well controlled. In this situation, you would still count the medication each shift or at least every 24 hours, whichever is applicable. You would add a new sheet as the old one is filled up. This would continue until either 1, the medication was administered, or 2, the medication expired and must be disposed of. Remember, fill out the medication destruction record. I highly recommend that you put the expiration date next to the name of the medication and double check it whenever you add another count sheet. That way it won't be expired if you ever need to administer it. In this example, we have several things going on. 1. Greta gave the first dose after receiving the medications at 6 p.m. She verified the number of pills on hand, which was 60. Documented she gave 1. Verified that she had 59 remaining. 2. John and Greta counted at 7 p.m., confirming the count was correct. Notice the shift count is done on the same line as the last medication given in the off-going shift, which would be 7A to 7P. 3. John gave the 6 a.m. dose. 4. Greta and John counted at 7 a.m. 5. Greta did not give the 6 p.m. dose because Jessie refused. The refusal was documented on the MAR. Notice there's not a documentation on the side where you would document the administration. 6. At 7 p.m., John and Greta counted, confirmed the number remaining was correct, and brought it down to the line with the shift count documentation. In this example, John is a live-in, so there are no shifts. He is required to count at least every 24 hours and chooses to do so at 7 p.m. each night. Quick recap. 1. When a supply of controlled medication is received, you fill out the top of the form. Start date equals date received. That's the blue highlighted portion. 2. The number remaining is how many are there. Right at this moment, if you counted. That's the yellow highlighted portion. 3. When you give a medication, you document in the green area. The number on hand should always equal the number remaining from the previous line. If not, med error, your count is off. You enter your name as the person administering and the number given. Verify the amount remaining equals the number on hand when you started minus the number given. 4. When you do a shift count or daily count, you document in the orange area. The number you count equals the number remaining. If not, med error, your count is off.